Romania is located in southeast Europe, bordered by the Black Sea, Bulgaria, Serbia, Hungary, Ukraine, and Moldova. Romania is home to more than 19 million individuals consisting of Romanians, Hungarians, Romas, Germans, and Ukrainians. Located in the heart of Transylvania, Cluj-Napoca is the second most populous city in Romania and houses the country's largest university, Babeș-Bolyai. In 2015, Cluj was awarded the European Youth Capital, showcasing its youth-related cultural, social, political, and economic life. We were lucky enough to have the opportunity to live in Cluj for 4 weeks. Cluj was the perfect home away from home. The city offered an overwhelmingly amount of weekly activities, such as live music, city festivals, street vendors, and much more. We were also able to escape the city and explore more of Transylvania, seeing some of Europe's best-preserved medieval cities, Brasov, Sibiu, and Sighișoara. We were delighted to travel and tour Bronze Castle, or more famously known as Dracula's Castle. In addition to our travels, we visited local agencies to learn how their efforts have contributed to Romania's population. One agency that stuck with us the most was the Autism Association. But first, we needed to research more about the topic of autism to better understand the history and diagnosis. In 1943, Leo Kanner, a child psychiatrist at Johns Hopkins, coined the term infant autism, describing pediatric patients who shared similar symptoms. Autism is derived from the Greek word autos, meaning himself. This term reflected Kanner's observation of the children who were absorbed in their own inner world, ignoring the people and events outside of it. Prior to Kanner, most children were diagnosed as developmentally disabled or emotionally disturbed. Autism spectrum disorder is defined as a marked impairment in socialization, communication, and sometimes sensory integration. ASD is typically diagnosed in children around the ages of 3 and 4, with symptoms including, but not limited to, difficulties in using or understanding language, unusual play with toys and other objects, difficulty with changes in routine and their surroundings, and unusual response to bright lights and loud noises. In 2010, the Center for Disease Control reported that 1 out of 68 children live with ASD, and this number has increased since the 2000s. In 2002, it was estimated that 7 out of every 1,000 children live with ASD at the age of 8. In 2010, that number changed to 15 out of every 1,000. Autism spectrum disorder is 5 times more common in boys than girls. The startling increase of autism is believed to be due to harmful environmental toxins, infectious agents, prenatal medication, food additives, and/or similar exposures that previous children did not face. It is difficult to pinpoint what has sparked this increase because the exact cause of ASD is unknown. Researchers believe the disorder has likely stemmed from complex and numerous sets of influences, where gender and genetics play a role. It is often believed that ASD is heritable, but most likely involves multiple genes rather than just one. Studies also suggest that exposure to certain environmental factors while in the womb may influence the development of ASD, a genetic phenomenon referred to as epigenetics. Up until the 1970s, doctors and scientists alike believed autism resulted from faulty parenting, there being a lack of affectionate bond between the parent and child. Only in the last 35 years has autism received recognition in the Diagnostic and Statistical Manual of Mental Disorders. In 1980, the DSM-3 introduced the diagnostic criteria for infantile autism. It was later revised in 1987 and changed to autistic disorder. In 1994, the DSM-4 revised the criteria and added Asperger's syndrome and pervasive developmental disorder, 2 disorders associated but separate of autism. In 2001, the American Academy of Pediatrics issued the first ever set of autism guidelines for clinicians. It implemented policies and routine screenings for all children ages 18 to 24 months old. Then lastly, in 2013, the DSM-5 combined autism, Asperger's, and pervasive developmental disorder with a single set of criteria for autism spectrum disorder, representing a more accurate medical and scientific set of criteria for diagnosis. While the United States was progressing in the studies and development of autistic spectrum disorder, Romania was fighting and breaking free of communism. Romania escaped communism in 1989, joined NATO in 2004, and finally the European Union in 2007. Because of the regime of communism, Romania has been significantly behind the Western world and most of Western Europe. Only recently has Romania seen an increase in research and relevant information regarding individuals with autism. However, doctors, pediatricians, and psychiatrists still find it difficult in early diagnosis. No screening instrument for ASD has been validated for use within Romania's population. It is also difficult to determine the numbers of individuals living with ASD in Romania. Medical tests cannot determine autism, and treatment is not typical in hospital settings. However, the health minister reported in 2012 that roughly 7,179 individuals have been diagnosed with ASD. More and more parents were faced with challenges regarding ASD, thus there has been an increase in centers and legislation regarding information for ASD. In the early 1990s, many non-government organizations emerged to tackle the social issues within Romania. One foundation in particular, the Romanian Angel Appeal Foundation, began in 1991 and focused on children with special needs. The foundation has expanded and created autism initiatives, including programs and projects, to better and serve this vulnerable population. In 2010, the foundation began a 3-year national training program to develop and deliver a model of diagnostic and therapeutic services aimed for children with ASD. The Romanian Angel Appeal Foundation has steadily increased the awareness of autism in Romania as well as Autism Transylvania. Autism Transylvania is a recovery center for children with autism and currently provides active support, treatment, and care for 81 children ages between 1 and 15. The center delivers a range of therapies, each unique to the child and his or her range of ASD. The center also focuses on social integration within the school and family by shifting the mentality and social attitudes towards children with special needs. Support and training is also available for families with autistic children. The association strives to inform and bring awareness to the city of Cluj and the surrounding community about autism. During our time at the center, we were able to observe multiple types of therapies used for the children. The primary goal of all therapy is to facilitate social and communication development, reduce behavioral problems, and to increase independent living skills. Each type of therapy approaches improving these developmental skills in unique ways. One of the first types of therapies we were able to observe was speech therapy. Speech therapy involves supporting all levels of speech development, ranging from supporting nonverbal children by making sounds to increasing a child's understanding of words and their meanings. One technique speech therapist incorporates is mirroring. The child watches the shapes of the speech therapist's lips in the mirror while he or she makes specific sounds. The speech therapist supports the child in creating the shapes with their lips through observation. During one of our observations, the speech therapist pushed her fingers into different areas of the child's cheeks, showing him the shapes his mouth should make associated with the sounds especially like ooh and ah. One of the tools that speech therapists use, the oral motor sensory tool, draws the children's attention to specific areas of the mouth or lips. This tool vibrates and has interchangeable heads and can also be used as a reward for children. During one speech therapy session, we observed this speech therapist using the vibrating spoon stick, rewarding the child with food after he made the correct sound. This also helps the children to become familiar with different food textures. Toys that promote the child's ability to blow air are also popular tools used in speech therapy. This exercise promotes the development of the child's mouth muscles and their ability to consciously control their breath and lip movements. During our time observing, the speech therapist held the child's nose closed in order to encourage the child to use his mouth to breathe. The child successfully made the ball rise in the air. This was his first successful attempt. The speech therapist was very encouraging of the child, and it was obvious the child was pleased he had accomplished something new. The picture exchange communication system is a type of therapeutic intervention that provides an alternative means of communication for nonverbal children. The picture exchange communication system is able to help clients express more than just their wants and their needs. As seen here, the system also allows children to express emotions and communicate what they're thinking, which is typically difficult for those with ASD. Children are taught to choose a picture of a desired item so the therapist can present such item or activity. A child displayed the soft play room card, indicating his desire to go there next. Soft play is a room dedicated to all soft things, stuffed animals, squishy foam floors, and other safe play items. As students, one of the aspects we enjoyed most about our time at the Autism Association was the opportunity to work along the side of children and therapists during horse therapy. Horse therapy can promote improvements in the client's motor, cognitive, and social skills. The process is used to improve posture, balance, and mobility, all while developing a therapeutic bond between the client and the horse. The therapeutic bond can promote a relaxed state in the client, allowing the client to increase self-awareness and confidence. There are many ways clients can obtain benefits from horse therapy, whether or not they even rode the horse. For example, activities such as grooming the horse can also foster a therapeutic relationship. All of the children at the association who participated in the horse therapy did ride the horse, regardless of the severity of their condition. The center put a great deal of time and effort into providing each one of the children the most impactful experience for them as an individual. Some of the children sat upright while others lied down, but a therapist accompanied each child during their time on the horse. Some children also played with ribbons as a means of distraction, allowing it to trail behind them in the wind or holding both ends in their hands. In addition to learning about the impacts of horse therapy, it gave us the opportunity to participate first-handedly, working side by side with community members and experiencing the beauty outside of Cluj. We feel extremely lucky being able to join the group during horse therapy, and it was an incredible eye-opening experience. Reflecting back at our time in the center, the various types and use of therapies open our minds on why therapy is so helpful and necessary, especially for children with ASD. Therapy is extremely important when introduced to the child at a young age. Many child developmental experts believe early diagnosis, along with behavioral therapy, provides the best outcome for the social and emotional challenges for affected individuals and their families.